morning, good afternoon, wherever you are. And this is Gerald from Ship Health, the Spine Health Improvement Program. Today, I'm here to share yet another interesting topic with you guys. It's called as the cervicogenic headache. In other words, which simply means headache that results from the neck problems. Okay, uh, I'm sure headache is one of the common problems many suffer from, but the saddest part is most of us are unaware of one of the important causes of headache, which could be in and around your neck. And that's exactly what we're going to discuss today. And I'm not going to talk about all types of headache in general, but I'm just specifically going to talk about one of the problems, which is headache that results from the neck problems. Okay, so let's take a look at some of the causes of headache. Like your headache could be the result of alcohol induced hangover, and your headache could result from so many other serious issues like brain tumors and blood clot in your brain, and bleeding in and around the brain could even cause headache, and carbon monoxide poisoning and concussion. If you suppose have some blow on your head, then the confusion and other issues can cause headache as well. And the problems in your eyes like glaucoma can also cause headache, and some of the infections like influenza and so many other infections, even some of the running nose that people suffer from, can even cause headache. And overuse of pain medication, and not just pain medication, so many other medications can also result in headache. And people suffer from panic attacks and anxiety, depression, which can also result in headache. And your headache could be a sign of stroke that you people may develop. And some of the ingredients like monosodium glutamate, MSG is how it is called, and when this is extensively added to our food, which is typically found in fast food and all the junk food like those chips and all those stuff that we eat, could also create headache. Okay, and let's see some of the other common causes of headache. Like those are some of the serious ones, but the most common cause of the normal headache people suffer from is dehydration. When your body does not have enough of water, then that's exactly what we call as dehydration, and that could result in headache. And people suffer from chronic stress, and they tend to overeat. They don't get enough of rest that they need, and which can also result in headache. And migraine headaches can is one of the important causes of headache. And sleep deprivation, when people are not getting enough of sleep, they could suffer from headache as well. But what I'm going to discuss today is this last one, the neck problems, which can result in headache, which is exactly what we call as the cervicogenic headache. Cervical meaning the neck region, and genic is the origin. Okay, cervicogenic headache, which like more than 50% of people who suffer from headache are said to suffer from an issue like this. So anyone who is suffering from headache, you may just have to carefully listen to this and find out if this is exactly what you're suffering from. But you may not be suffering from what I'm about to share with you today. But if that's the case, then you may visit this site that I've mentioned in this slide, the last one, headaches.org. And it's an interesting site where I just came across varieties of headaches, the causes, the symptoms, and what could possibly be the treatment. And in a very concise fashion, they have just shared it. So you may just go through that. I'll share this link in the comment section once I post this onto the Facebook or YouTube as well. All right, so now these are the causes, and now what we are going to discuss, as I mentioned, is the headache that results from neck problem. Now that we know headache, most of the headaches result from the neck problems. Now we need to try and understand what exactly is the relationship between our neck problem and the headache? What causes the neck problem, and how does it cause headache in turn? So sometimes it could be just a poor sitting posture. Like, most of us don't care about how we sit, but ideally we need to be maintaining a good sitting posture, which I'll be explaining soon. And poor sleeping posture. Somehow, let me just get the sleep is how we sleep. And there are positions in sleeping which you shouldn't be trying at all. So I'll be discussing about that as well. And then prolonged sitting. There are people who know that they have to just maintain a good posture while sitting, but their problem is that they sit for long hours. And when you sit for long hours, it is impossible for you to maintain a right posture. So that's something I want you to understand. So prolonged sitting, and then poor chair or seat. And when it comes to sitting, even if you want to maintain a good posture, the most important thing is choosing the right kind of chair. I'll try to explain that as well, if possible, today. And your car seat, and sometimes your car seat may not be so appropriate that you may have to stoop forward, which can also result in headache, in the neck problem, and then eventually result in headache. And wrong positioning of your computer. You know, keeping your computer at a right height is very important, but sometimes we don't care about it. Either we may keep it over the side, or we may not be keeping it at an appropriate height, which could also result in neck problems and headache. Okay, so now that we know what are the causes of problems around the neck, and here's an interesting information that I would like to share with you: the bad effects of forward head posture. So normally your head weighs around 12 pounds. Suppose if someone would ask you, do you know what is the weight of the head? No, the answer is your head weighs around 12 pounds. And your neck, the muscles of your neck and the joints of your neck are the ones to bear the weight of your head. They are the ones to just, transfer the weight to the lower part of your body. So but when you just put your head forward, let's say like 2 inches forward, the weight of the head acting on your neck muscles and joints exceeds 12 pounds, and it turns out to be 32 pounds. So uh, when your head is like 2 inches forward, the weight of your head is 32 pounds. That's exactly what your neck experiences. And then when you just stoop your head further down, like let's say 3 inches forward, the weight of the head acting on your neck muscles and joints turns out to be 42 pounds. That's like 4 times the normal weight of your head that's acting on your neck. Let me tell you this: your neck muscles and joints are not designed to bear so much load for an extended duration. So there are two problems that I would like to bring to your notice now. One is you cannot put your head into a forward head posture quite often. And the next thing is, based on the duration your head is put into that position, your neck muscles can get into serious trouble. They are so much stressed, and as a result of which, you may develop spasm around these the muscles of your neck. And there are so many muscles of your neck which can get into trouble. One such muscle is what I'm going to share with you today. And these muscles are called as the suboccipital muscles. Okay. So let me just share my screen once again with you. I just got to switch over to another application here. Okay, so now there's a group of muscles which are called as the suboccipital muscles. Suboccipital simply means the junction between the lower part of your skull and the upper part of your neck. So let me show that to you. Okay, so this is exactly the suboccipital region. And the muscles that I'm going to talk about is these muscles, which are called as the suboccipital muscles, like what I'm pointing out here are the suboccipital muscles. Okay, so there are four muscles basically on one side and four muscles on the other side. So the function of these muscles is to extend your head like this, move your head backward, and they move your head sideways, and they move your head like this. Rotate your head to the side like this, joining with so many other muscles of your neck. But the reason why I want to talk about this muscle is because of this. Take a look at the other structures which are over here. In between these muscles come a wire-like structure. These structures, let me see if I can highlight that. Yeah, these structures that I'm highlighting are the nerves. These are called as the occipital nerves, which are coming from your brain and spinal cord, and they supply the side of your head, the back of your head, these muscles, and they even go to the top of your head over here. And these muscles, uh, if you take a look, they are just passing through these muscles. I mean, these nerves are passing through these muscles. And when you just place your head forward for a long time, exactly like how we saw here, uh, let me just share again. Like this, when your head is stooped forward, and these muscles could get into serious amount of stress, they get into spasm, and they begin to compress, irritate those nerves that I just showed you, and you may get various symptoms as a result of that. So what are those symptoms? So you may just develop pain right below your skull. The starting point of your pain is exactly the junction of your skull and the upper part of your neck. And the pain travels up your head, the back of your head. The pain travels over the side of your head and top of your head, and it can even come till the forehead. And sometimes this can even cause a crushing effect around your eyes. It can cause watery eyes because the pain is referred all the way through your head. And guess what? This can even cause dizziness, which could be an associated symptom. And people who develop these symptoms additionally develop anxiety because they just run to their neurologist and get their brain checked with an MRI, and all the examinations are done, and yet the brain is all fine. They are unable to find out what actually is causing all of these symptoms, as a result of which they get into anxiety, and they may develop, as a result of anxiety, they may develop slurred speech and balance and coordination problem. And there are people who even develop nausea and vomiting as well. So the symptoms actually look deadly, but actually the problem is not inside your skull. Like, it's not a problem in the brain, it is outside the skull. It is all over these nerves which are being irritated, the spasm of the muscle, and that actually causes all of these symptoms around your skull, around your eyes, around your forehead, and which is exactly the problem. So now we need to try and find out what exactly is the treatment for this problem. The treatment that I'm going to share with you is pretty much something that you can practice right at home. You really don't have to go to a hospital, and there are so many things that you can do it right at home, and you can fix the problem, believe me. So the first one is rest. When I say rest, I'm not meaning that you have to go sleep all throughout the day, but what I mean by rest is list down all of those aggravating factors. Like, it could be, your time that you spend on your laptop. You probably could be keeping your laptop right on your lap or on a table, and you just put your head down like this, and you just look into your laptop with your head down posture. You just give it a break, and you give it a break for some time, is what I mean by rest. And suppose if you're looking into your mobile phone, you're spending a lot of time on your screen, then you have to definitely just give it a break. It's not just a break, and for the rest of your life you just have to make some corrections. I'll share that with you as well. So that's exactly what I mean by rest. And when you just go on a rest, like let's say 1 week or 2 weeks of just completely staying away from your mobile phone or your computer, which has caused the problem, then these muscles could actually get out of their spasm. They get a lot of relaxation, they get out of their spasm, and you could get a lot of relief. So when you return back to your work, then I want you to just keep your computer at a right height. What is the right height? Keeping your computer at your eye level is what I mean by right height. Okay, and I'm just practicing what I preach. My computer is kept at a at the eye level. Okay, then the next one is heat. Now, people have confusion whether to apply cold or heat for their neck problem. So I would prefer heat for an issue like this because it can relax your spasm. It can also cause, improve the vascularity. It improves the circulation, and you get a lot of benefit out of that. And the next one is posture correction. I think I'm just missing a couple of slides. So the next one is the posture correction. So normally, let me just try to just play it from the beginning. Okay. Normally, we are unaware of our posture. So from whatever posture you are sitting, then I would recommend that you retract your shoulder and then you take your neck backward, your head backward. And let's take a look at it once again. So this could be the normal posture, then retract your shoulder backward, and then you just take your head and neck backward as well. So that's called as a chin tuck position. So that's a posture correction that you may have to follow. All right. So something, a video that I forgot to include is a sleeping posture, which is very, very important. Let me discuss about the sleeping posture. When it comes to sleeping, there's a position that you shouldn't be sleeping at all. That is sleeping on your face. Okay. So there are a lot of problems that can happen as a result of sleeping on your face, but your chest could be compressed, the chest expansion could be restricted, and this could result in a lot of problem. But the most important thing for our topic today is your neck goes into this position when you sleep on your face, which is not at all right. And that by itself could cause a lot of problem, not just the cervicogenic headache, but neck problem on its own. So it is important that you don't sleep on your face. So what are the position you can sleep? You can either sleep on your side or you can sleep on your back facing the ceiling. Okay. So when you're sleeping on your side, suppose there's something called as a neutral position of your neck. So now what I have is the neutral position. If your head moves forward or backward like this or falls onto the side like that, it's not a neutral position. This is the neutral position, right? So neutral position is none other than something where your neck muscles and the joints could be in a much relaxed position. Okay. So when you're sleeping on your side, you will make sure your neck is in a neutral position and it's not falling back. Suppose if you use a small pillow like this and you try to rest your head on that, your neck could just fall off like that. Ideally, if you can just place a bigger pillow to, your shoulder would rest on the bed and you fill the gap between the shoulder and your head with a pillow that's of an adequate size, and making sure your neck remains in a neutral position, that's something that you need to follow. And suppose if you're sleeping on your back, so again, you cannot use a big pillow which can push your neck into this position, which is not right. And if you're not using pillow at all, your neck could go into that position. It could go into that extended position, or it could fall off like that, which is not again a neutral position. So you will ideally use a pillow that would help you maintain the neutral position. It's usually something of 1 or 2 inches big, which should be just good enough. Okay. And suppose if you're an obese person, then you may need a bigger pillow. So the point is this: when you're sleeping or when you're sitting, you have to maintain the neutral position, and you make all the adjustments in your posture and in your environment, which would help you maintain the neutral position. I hope you get the point there. If you have any doubts, feel free to comment below and I'll be happy to answer that. Okay. And the next one And the next one is this one, self kneading. Okay, so when you just develop a pain around your neck, this is called as a plain kneading, where you put your fingers around the exactly over the area where you have the pain, and then you just let me just slightly rewind it. So you just move your fingers through that place where you have the pain. That's exactly where the muscles are, right? So you just do this plain kneading around these places, where these neck muscles, the muscles that I showed you, can just completely relax. And then you do a circular kneading like this, which can also help these muscles relax. Okay, so this is called as the kneading technique, which you can do to get some relief. All right. And the next one is the chin tuck. And this is an exercise that would help to realign your neck joints. Okay. So, as a result of, keeping your head in a forward head posture for several months, several years, your neck could have just got out of its alignment, and this can help to fix that problem. This can help to realign your neck and just even stretch these muscles and relax them. So how you do that is by keeping, that's your starting position, and then you take your neck backward. When you do this exercise, your nose and eyes should just point the wall forward. Okay, so that's called as chin tuck. Maybe you can just take a look at it once again, or you can rewind the video and watch it. Okay, so you take your neck backward, and then with both your hands, you just apply a gentle overpressure over your chin. All right. So, what is the next technique? This is the stretching uh, that you can do to relax the occipital muscles, the suboccipital muscles, what I showed you. So, how you do the stretch is by first do the chin tuck and then bend your head forward. And the third step is to apply gentle overpressure by placing your hands over the back of your head and gently bending it forward. Chin tuck first and bend your head forward, and then overpressure with your hands. Three steps. Okay. So, again, you can rewind this video and learn the proper technique to stretch. So when you chin tuck and then bend your head forward, that's when you get the stretch over the upper part of your neck. If you don't do the chin tuck and bend your neck forward, you may get the stretch over the lower part of your neck, which may not be the right kind of stretch you want to do. And the next one, so this is called as, again, the trigger release with a ball. It's more like the kneading, but here you may use a hard tennis ball or something like that and place it exactly over that part where the muscles are, or the area where you experience the pain, and then you may just roll your head gently over the ball, which, believe me, this is an amazing technique. And when you do that, you instantly find that release, instantly find that relief, pain relief that you want. So you place the ball over that place where you experience the pain, and gently rotate your head back and forth like this. All right. And you may do this technique in standing, where you place the ball uh, over your neck where you have pain, and again you just move the ball gently over the area where you experience pain. I'm sure this is another one. Suppose if you're not so comfortable doing it in lying, you may just stand and do this, the trigger release with the ball. Okay, so I don't think I have any more slides, and that's it So if you have any doubts regarding what I shared with you today, you may just post your comments, post your doubts in the comment section below, and I'll try to answer those questions. And friends, if you know of someone in your family or your colleague who probably may be suffering from a headache like this, I want you to share this with them and let them be benefited. I'll see you soon with another interesting topic like this, which could benefit you. And I'll catch you up soon. God bless you and stay safe during this period of pandemic. I'll catch you up. This is Gerald signing off from Ship Health, the Spine Health Improvement Program.